Welcome to Ardenwood Presents, our Ardenwood Presents webinar to answer questions about long-term care for Christian Scientists. We hope you enjoyed last week's presentation. I'm John Mitchell, and I serve as Executive Director and CEO of Ardenwood here in San Francisco. Thank you for joining us today. You are invaluable to Ardenwood, and as you know, Ardenwood is a 501c3 charitable nonprofit organization. This means donations from you are essential to help us meet our operating expenses. Your support enables us to offer uninterrupted services, something we've been doing for generations. In return, we want to provide you with the best possible care and special events like this one. You bring out the best in us, and we thank you. I want to be sure you know about our next online event, our 2021 annual meeting, on Sunday, May 2nd at 2 p.m. Pacific. Madeline Maupin will be our inspirational speaker, and the title of her talk is The Bible's Golden Thread of Healing, God's Presence. Please keep your eye out for an invitation via email and regular mail. Now, before we begin, why are we talking about long-term care for Christian Scientists, which seems like such a contradiction? Because Christian Scientists are wise. They make responsible, informed, personal decisions. Just as important, they don't want to be a burden to their families, not physically, not emotionally, and not financially. Ardenwood is not a long-term care facility. It is not a nursing home. People who come to Ardenwood come for healing. They expect to be healed, as healing is our primary focus. Financing care through Medicare and supplemental insurance helps to cover these shorter-term needs while the patient is actively, metaphysically addressing the specific claims about their well-being. We've all experienced unexpected circumstances in life, ones that encourage us to be better prepared and force us to grow. Long-term care insurance is one way to ensure your care needs and wishes are met without burdening your family or loved ones. Now, as we've shared in previous webinars, one of the most important first steps in planning is to complete an Advanced Healthcare Directive, or an Ahcd, and let your family or close friends know where it is. You can find an example of one on our website, ardenwood.org, in the middle of our homepage where it says, Join Us. Click on the last item in the box to find the Ahcd. This first step is so important to your planning. We hope that today's Q&A webinar will answer many of the questions you may have. If more questions come to mind, you are welcome to contact Jim or Leslie or Rogers. Finally, the content shared today is only informational. It is not intended to be legal advice. A replay of this presentation will be available on our website tomorrow morning. And now let me once again reintroduce Jim Maher and Leslie DeFrisco. I want to also mention another valuable resource, the Christian Science Provider Network. That's an organization that helps Christian Scientists with questions related to Medicare Advantage plans, supplemental policies, and insurance. Everyone's contact information will appear on the screen at the very end of this webinar. So, Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's been helping individuals and companies navigate Medicare since 1989. Jim's also a certified long-term care insurance strategist. Jim lives in Lincoln, California, with Teddy, his wife of 34 years. And here we go, Jim. They're spoiled rat terriers. I love that. Leslie DeFrisco, Ardenwood's Director of Christian Science Nursing Services, is with us. Leslie oversees everything related to Christian Science nursing here. Leslie graduated from the Mother Church's training program, has been a journalist since 1981. One of Leslie's responsibilities is to work with Medicare and insurance to ensure proper coverage for our patients who choose to use their Medicare benefit. And she's joined in this effort by another Ardenwood colleague, Rogers Spear, who processes our Medicare and supplemental insurance paperwork. very complex work. We're grateful to have Rogers. So Rogers will join Jim and Leslie during the Q&A present period. And lastly, we have an addition today. Our Director of Communications, Amy Sparkman, will also join us to help summarize the key points in this webinar. Now, before we begin, let me explain how you can ask questions. If you look at the bottom of your Zoom screen, you'll see an icon that says Q&A. Simply click on it, and a screen will appear where you can type in a question. Press submit, and it will arrive here. We'll collect them and save them for the end of the presentation. We've still got some questions from last week, as you know. Please join me now in welcoming Jim and Leslie.
Good afternoon. As John just said, Ardenwood is not a nursing home, and we are always expectant of healing. It's never too late for healing. No matter what age we are, it's never too early to start challenging the beliefs of aging. Don't buy into the beliefs about certain faculties or mental capacities declining as the years move on. Handle these claims in their first suggestion. If some of the information you heard last week felt discouraging, perhaps it's because you didn't purchase insurance when you were younger, or you didn't realize the actual cost of care. It's not too late to address these concerns either. There are still some options available. Jim will talk more about transferring annuities into long-term care insurance, and I will share with you some other possible funding options available for Christian Science nursing care. The most important thing is that you seek care and support early. Don't let fear of cost or anything else prevent you from calling on a Christian Science practitioner or Christian Science nurse and getting the help you need. I'll turn it over to Jim.
All right. Thanks, Leslie. Hi, everyone. It's nice to see all of you, and I've talked to so many in the last few days. Being overwhelmed is I think I've talked to 100 plus. So I want to apologize if I'm tardy getting back to you. I won't forget. I've got all your names. I've got emails. I've got a list. And Katie in my office, who is also excellent with long-term care, also in Medicare, she's helping assist me too. We just didn't think we'd have that response. So it's been overwhelming. I've talked to people throughout the United States, from Maine to Florida, literally to Washington, to Arizona, to Indiana, numerous states. And it's just an absolute pleasure talking to you. As a non-Christian scientist, I am a Christian. And it's just, you're the greatest people to work with I've ever worked with in going on 33 years. You're all incredibly nice. You're intelligent. You understand everything. And like John was saying, you just want to do things to help and protect your family. And I'm finally, with the help of Leslie and Amy and John and Rogers, starting to really understand the Christian Scientist philosophy of really being healed. And the non-Christian Science world, this doesn't happen. Okay, you're so healthy, and the spiritual healing when you come out of the facility, it's amazing. Most non-scientists, that doesn't happen to. So you're very fortunate. I share your faith. I wished I just do, but I'm here to help and answer any questions. My email information will be there after, I think we'll show it, or you can call. You have mine and Katie's information. What else was I going to tell you? I've been working on a couple products. It's not easy, right? John can tell you that, and it's not easy finding insurance companies that are Christian Science friendly, that actually understand kind of what's going on. But I've got one tomorrow I'm meeting with, so I may have some great news. And as soon as I learn of it, I will let everybody at Ardenwood know. So stay tuned for that. So I'm working on your behalf. It's just not easy out there. Rogers can tell you these insurance companies are tough to deal with sometimes. And we're trying to find ones that can be beneficial for everyone. So that was my introduction. So John, do we want to?
Jim, actually, I'd like to interrupt with a quick question for you, just to clarify something you said, and that is, you've been receiving calls from all over the country. Are you able to answer questions, those questions, when people are calling from states other than California?
Yes, because the nice thing too, not only long-term care, it's pretty much the same in every single state, but also a lot of people are asking Medicare questions too, which is still super important. And Leslie's remind me how important that is, that scientists understand when they come in how important it is to have Medicare. So I'm talking a lot about Medicare A and B and how important it is, and how supplements can help buffer from extended stays, I should say. But ultimately, I can help anybody in any state.
Great, thank you.
Perfect. Well, let's continue on into questions then. The first one, and once again, people know how to do them, and it looks like I see a few coming in, Amy.
Yeah.
So the first one is, with asset-based long-term care, is there a maximum payout, or do they only pay out when you have to put in what you have put in and earned, quote unquote?
No. So examples are probably easiest here, because asset-based means you're putting money into an insurance product. And I'm just going to use this number for an example. Please don't think you have to use it, but I have to show some kind of example. So if somebody is in 65 and they put in $100,000, for example, it can be less, it can be more. Normally, there's a multiplier which would turn it into anywhere from 2 to 4 times that amount. So if I put 100,000 in, I may right away have a $300,000 benefit for long-term care. If I have inflation protection on that, that can continue to grow. So when I really need it in 15 or 20 years from now, that amount has increased, and it's paid out monthly. That's about as much as I can go into without showing specific examples. But the answer is it's a multiplier depending on your age and your health.
Great. Second question is, I'm 90, I'm in good health, have never been in a hospital. This kind of underscores your earlier points, Jim. How much would LTC insurance or long-term care insurance cost?
Well, right now it's really hard because most non-scientists, they can't even qualify for a long-term care policy. I'm sure you can. The issue we're having is finding somebody that will go up to age 90 and beyond. Normally they have a cutoff at certain ages, but that's like there's other insurance products such as an annuity out there. So I'm looking for you. I may have that answer that I can help a 90-year-old. Right now, I'm going to do a lot of praying for you also, because I'm not sure if we have the product, but I will try and find something out there.
Jim, can you clarify the age that is the top age currently? And I think I've heard you say that there might be a couple of carriers that can address a larger age span. I know there are many questions. I'm in my early 70s, I'm in my 80s, I'm 90.
Yeah, usually, and it's really hard because each insurance company, especially the ones where we're limited to, some go to age 75, some go to 80, some go to 85. I'm speaking to one tomorrow that may go to age 90. So it's hard to say, but right now I'm trying to find something that I can help anybody from 50 to probably 90. 90 plus may be a challenge, but you're way ahead. I would take your health and your age any day. So, but that's anywhere in that range. It's hard. Certain carriers have certain cutoffs of 75, 79, 80. But that's why when I'm talking to most scientists, I'm trying to get some type of a questionnaire so I can find out a little bit more about them before I ever make a recommendation.
And while we're on this same question, just one more follow-up that has come through many times is there a standard fee or cost to the long-term care insurance, or does that relate to the carrier? How can you help people understand the cost, especially as they move up in their years?
Yes, and that's a tough question, because the number one question everybody asks me is how much does long-term care cost, right? I get that number one question, and it's I tell people it's $10,000 to $12,000 to $14,000 a month. and their jaw drops. And I said, well, no, that's the cost of care. Well, if you can't afford that, then we need to look at some other options. So it really, it depends. And I'm not trying to dance around it. I don't want to say it costs X amount every month, because everybody is different. In the presentation, I talk about there's no cookie cutter plans. So everybody is different and special. And I try and treat everyone that way and find something that what works for you may not work for your sister-in-law or your neighbor, but I'm certainly willing to try and help everyone. So I wished I had a standard answer, but there's just not one.
And Leslie, just to tag on to what Jim just said, that's true for us too. We get a lot of questions that say, how much does Ardenwood cost? X, and we have our different fees, but can you explore that a little bit?
Sure. We have a tiered rate system, so it would, even within each level of care, we have a skilled Christian Science nursing floor. We have a lighter care called Christian Science care that's not Medicare coverable. It's kind of in the middle. And then we have sheltered care. Each one of those has different levels and different rates, and that's based on the number of hours that we spend giving care. So there's no easy answer to that, and it might even fluctuate from day to day in some cases, or month to month.
Leslie, this might be just the right time to calm everyone down by pointing out some options for covering the cost of care that we have access to.
Sure. Well, we're just so grateful for the National Fund for Christian Science Nursing. And that fund is administered through the Principal Foundation and in Kansas City, and it will help with the cost of Christian Science nursing care, whether it is skilled care, lighter care, sheltered care, or care in the home, as long as a Christian Science nurse is the one giving the care. So that leaves it fairly wide open. It's a very simple application process. You can go to their website, do it online. It's nfcsn.org. Or if you even went to the Principal Foundation website, I bet you'd find a link to it. They've been very easy to work with, very generous, and it is renewable month to month as the care needs, if the care needs continue. We have several patients here that have received funding through it, as well as at home. There also can be assistance with the cost of Christian Science practitioners. There are some Christian Science associations and a few branch churches that might even have some funding available for Christian Science nursing care, as well as longtime serving Christian Science practitioners and Christian Science nurses may be eligible for funding through the mother church. So there's lots of options out there.
And we want people to choose Christian Science care first. Excuse me. Ryan.
Yeah, I would like to mention again the National Fund for Christian Science Nursing. I've just found that fund to be so helpful to our patients, and would highly recommend that if you are in a situation where you're using a Christian Science nurse, that you talk with them, because they really are wanting to support Christian Science treatment and Christian Science healing, and not really look too much at the asset base, whether you have a lot or you have a little. They do look at that. You do have as Leslie said, a small financial statement to fill out, but they are looking to see, and I think they're looking at saying that we want to support Christian Science treatment and healing. We know you're going to need your funds after you make your healing, so we're not going to make you spend down to your last penny before we will step in and help you. And I think that's a paradigm shift from years past.
You don't have to sell your home, because they expect you to return to your home. So.
Exactly. And so they are really wanting to support Christian Science treatment and Christian Science healing through the method that they have available, which is some financial help. And so I have several people have said, "Oh, well, we're pretty well off, but we do need, it'd be nice to have some care or some help." Talk to them, because they, you'll have to pay some, and they might be able to pay some too. So it's been a really wonderful program that we've had a little over 3 years now, maybe 4 years even coming up on.
2017, yes. Question number 3. For 24 years, I have paid for CalPERS long-term care in a facility for life. However, it doesn't cover a non-medical healthcare facility such as Arden would. It is not reimbursable. How can I improve it?
Well, that's a tough question. So CalPERS is the leading issuer of long-term care insurance in California by far. Most of their policies are all based on reimbursement, and I understand, but that's most provisions and most policies now that state it's got to be a licensed healthcare facility. So in that instance, after you're healed, and if you were coming home, you would be able to use the monies for care at home, right, with activities of daily living, homemaker services, cooking, laundry, helping with bills. Even if you needed to move on to another residential care assisted living facility, wasn't a rinky. So that's when those policies would pay.
Okay.
To enhance it, we can look at some options, but unfortunately, the CalPERS policies they're not an insurance company, right? They're not regulated by an insurance company, so they kind of have their own rules.
Thank you, Jim. Next up, can a person with a lifelong disability and is young, in their late 20s, qualify for any long-term care plan?
Boy, the answer is it depends. It depends on the disability. Each carrier, each insurance company has different questions. Some are more friendly depending on your disability. So that would be something you would have to email me and see if I can help you that way.
Great. And Jim, as he mentioned earlier, is talking with carriers. There's some really neat opportunities that I've not seen in all the years I've been associated with this, which goes back to around 1999, 2000. So Jim has made great headway in this area. So we're grateful for all your work, Jim. Question 5, can you tell us a bit more about Medicare Supplement that covers skilled care at Arden Wood? That's Rogers and Leslie.
If the care need would qualify for skilled Christian Science nursing care and Medicare, then the Medicare supplemental would automatically kick in. Is that right, Rogers? It simply would cover deductibles and...
Yeah, if the illness is Medicare qualified, and so you're receiving, we're being able to make the claim through Medicare, then the supplemental would be helpful and would kick in for those payments that would normally be paid by the individual. But if it's not covered by Medicare, it's not going to be covered by the supplemental at all.
Right. In addition to the deductibles, it can continue on beyond the, say, 90-day period of Medicare. It can continue on often for many months, up to a year even, and cover all the expenses should there continue to be a skilled care need.
Yeah, that's so important. As a matter of fact, I had a question from a scientist today, and they were more concerned about, well, how would long-term care work in lieu of Medicare? I said, Medicare is probably more important, right, Leslie, that they understand that they have A and B, and
Yes.
that gets you, if you're in a rinky like Arden would, that would cover it. And if you have a supplemental plan, like Rogers talked about, you don't have to worry about beyond 60 days, beyond 90 days, right? And beyond, because it gets really expensive after 60 days, Rogers. What is it, $371 a day now if you didn't have a supplemental plan? So
yeah, for day 61 and on, and then day 91, it doubles.
It goes to $742, right? So a supplement, that's why I think that's so important that people understand that. I told them in order of take care of your Medicare, make sure you've got that straightened out, and a supplement before we look at the long-term care. I think that would be a good order to go in, quite honestly, to make sure that they're taken care of.
Great point. Next up, I have long-term care insurance, which I have had for many years. The premiums have increased this year. Should I be comparing companies to change, or once I have it, am I stuck with that company?
Well, the answer, you're never stuck with a company, because if you decide to quit paying premiums, then you don't have that company anymore. So the answer is you're in control. What happened in the long-term care industry is a lot of these policies that were issued back when I first started in the late 80s and early 90s, they were way underpriced. You were paying, I remember seeing policies, they didn't charge enough. The companies didn't have enough experience in claims. And once these claims started to happen, they were longer than anticipated. The insurance company said, well, wait a sec, we didn't plan for that. We planned for some people to drop their policies, and that didn't happen. They found out people that were purchasing these long-term care policies, they didn't drop them. And then when this low interest rate environment hit a few years ago, back in the 2000s, that just really hurt insurance companies. So some became insolvent, some got out of the industry. There's quite a few of them that I've talked to that scientists have. They're no longer issuing policies. Even John and myself were talking about, like Allianz, it had a Christian Science rider. They're not issuing long-term care policies any longer. So everything has changed in the industry, and companies have had massive rate increases. Ones that said they never have, even though they weren't supposed to say that, they have. CalPERS has had, 7, 8, 9 rate increases. They just, because they can. So the answer is you don't have to stay with them, but you should never, ever drop your policy ever until you find out that there's something that's going to work better for you, and make sure that we can't, we'd have to enhance it. In other words, get something that's going to be better for you. A lot of the insurance companies will offer you where you can lessen your coverage from lifetime to 8 years or 6 years, or lessen your inflation protection from 5% compound to 3% compound. That's kind of getting insurance technical, but those are options. When they send you those rate increases that you're receiving, they have to give you some options on how to decrease your premium or maintain the premium with less benefit. Again, if you email me a specific, question and give me some details, I may be able to help you better.
Great. Next, is it a doctor who needs to certify an individual is unwell, which then activates the long-term care benefits?
In the verbiage of the insurance companies, it must be a licensed healthcare practitioner. So that's the definition in long-term care policies, a licensed healthcare practitioner.
Okay.
And that would be
how would
tough.
one do that? Yeah, excuse me.
Yeah, that would be tough for Arden Wood to qualify for. That could be a stickler in the fact that we're not licensed by a state agency or anything like that. We are, we are in compliance with the commission on Christian Science nursing, of course, but that's not a state agency, and so that technicality called licensed, a state licensed individual, I think that's difficult. What do you think, Leslie? Have you?
It is. I do know. I mean, I have filled out some paperwork for some insurance companies. So, and I have put, that we don't have medical staff here, and I have put the information, and I know a few have gone through, but I think generally it is tricky. Trying to explain the fact that we are certified by Medicare as a Part A provider gives some credibility in the eyes of the insurance world that, they actually do know what they're doing.
Right. And then, Rogers, there are type policies out there, they're called indemnity, where if an individual is qualified and they receive cash, that may be more beneficial, right? If somebody's coming into Arden Wood in that example.
Yes. Yeah. Again, it's what the trigger mechanism is. That I think is usually the sticking point as to whether people say, can I use it at Arden Wood? It's that trigger mechanism that whether it's you're going to receive the funds, or the funds are going to come to Ardenwood to pay the bill directly. It's still the trigger mechanism that is the main point to get over.
Right.
Great. Well, let's follow this through a little bit further. So then how would it happen? We've explained this, but how would we go about it to help this individual or individuals if they did want to start receiving their benefits? What would we do, or what could they do, Jim?
So Leslie had a good point. If they would honor, a nurse at Arden would, that would be fantastic. A couple of the insurance companies I've talked to said they would send out a qualified registered nurse or a licensed healthcare practitioner to help somebody that needs to be assessed. So it's dependent on the insurance companies, and I've talked to a couple of them on your behalf. Some of them aren't going to be helpful, and some of them are. So we just have to look at that on a case-by-case basis and make sure we get the right one for your situation, because I want to make sure we're helping you, not doing anything to harm you in any way.
Perfect. Thank you for that. Next up, if you put your advanced directive or healthcare directive in effect immediately, but you're not yet incapacitated regarding making healthcare decisions, who is in the driver's seat? Can you admit yourself for care without the agent becoming involved?
Yes, you are in charge. It's only when you cannot speak for yourself that the other person becomes able to do it. And of course, we don't know when that moment might be that we may not be able to speak for ourselves, whether it's not thinking clearly or literally not able to speak. That's why you want to have that provision already in there, having appointed someone you trust that could step in and honor your wishes and speak for you. But as long as you are able to speak and are making good decisions about what should happen, you absolutely are in charge of your care.
I want to give a quick example of my own experience. I had a need several years ago. I was quite ill. I was at our car dealership getting my car serviced, and I blacked out and hit the deck. I awoke in San Francisco General, and they took me there, and my wife couldn't get to the dealership in time. So what EMT does is they take you right to whatever hospital they're directed to. And it was very difficult for me to get out of that situation. Once I came to, they wanted to run all these tests, and it was quite an ordeal. It wasn't until the ER director spoke with Leslie, understanding that we were a Medicare Part A facility, that I was able to leave. But had my wife if we would have had, I didn't have an Ahcd at that time. That's why I feel so strongly about them. I've seen this happen so many times. Unless you have that piece of paper to show the hospital, they're not going to let you out of there, because they are now responsible for you. So everyone's trying to work to their highest sense of responsibility and care. And so it's good to have all of these things put in place so that you have your choice of care when you want to make that, or when you need to make that. You want to add anything to that, anyone?
No, it wasn't enough that his wife was standing there saying, "I'll take him off your hands." It was really needing to show that he would be taken to a facility that could give him care, and that we
Proper
were
care.
a credible facility. So it took some doing, but yes, we did get him that day, and he had a wonderful healing.
I did, but anyway, the Ahcd is very important on many levels. Next up, I'm 83, completely healthy, and just stopped working. I have a modest amount of assets. I live in an apartment with my son and his wife. Their plan is to care for me, but perhaps an asset-based policy is appropriate for me. Are there different levels of amounts that I could buy so my son and his wife could get some help if needed?
The answer is yes, you can buy different amounts, and it depends again on your situation. And we'd have to find, with your age, I'm talking to an insurance carrier tomorrow that I think is going to be very friendly to people up through age 90. So I'm quite excited. I told John I don't want to go like this yet, but I'm quite excited that we may be able to find something that would be affordable to help you in that specific situation. So
Great. So
Say a prayer for me tonight, please, because I'm going to need it with talking to these insurance companies. Okay, I really mean that. That helps. So,
Jim, you're amazing. These insurance companies are something else. Next up, what are the best supplemental plans for Christian Scientists that are accepted by Arden Wood?
That's a Rogers question.
The best one is, I guess, that what works for you. I mean, there's an alphabet of supplemental plans. Now, if we're using that term, I have to qualify. We are talking about supplemental plans for Medicare. We're not talking about long-term care insurance.
right.
And there's literally an alphabet of these supplemental plans. And in my thought, it's a financial decision. You have to look at how much of the deductible are you willing to pay? How much do you want them to pay? How much of a premium are you willing to pay for whatever benefit you perceive that you will get from it? But whether you have a plan F or a plan N, we work with it at Arden Wood. It's not really which one works for us. It's which one works for you in your financial situation and what type of coverage you want, and we will work with whatever plan you come in with.
Right. And how supplements work, just so people understand, they follow Medicare in the door. So it's not like you have to ask Rogers and say, I have company ABC or XYZ, where you take it, accept it. It follows Medicare. Medicare is the primary payer, and the Medicare supplements the secondary payer. So whatever facility you go to, it follows you. And I'm just going to say I've had great success throughout my career. I'm a big fan, and I know I'm not, well, I'm going to go ahead and name names. I really think the AARP United Healthcare Plan is outstanding. They do a great job, customer service, Rogers, and they seem to work really well. And I'm wondering if you've had any good experiences with them down there.
Yes, AARP does work really well, Jim, as far as, if it's a Medicare and a true supplemental, you have, traditional Medicare Part A, AARP works very well. Yeah.
I found them to be one of the best, quite honestly. And you never want to buy cheap. I always tell people, do not buy the cheapest. You want to buy a quality Medicare supplement plan that's going to be there. And AARP United Healthcare it's worked for me for years, and I know a lot of scientists have it too. So that's one of my favorite companies.
And interesting, I've administered a number of different ones. The ones directly through AARP go through pretty well, pretty easily, as opposed to even ones that are directly purchased through UHC, who underwrites AARP. But who's ever administering the AARP ones really do a good job.
I just wanted to add that when someone comes to Arden Wood, I'm actually on the committee that helps make a decision that it is indeed Medicare coverable based on an assessment of the needs for skilled care. So that determination is being made by Christian Science nurses. It's not requiring a diagnosis or anything. So once that decision is made and we file for Medicare, and the supplemental can kick in as well. If it's a Medicare Advantage plan, it is a whole different story. So
yes.
There is a difference between United Healthcare that is a Medicare Advantage and United Healthcare that is a supplemental plan.
Absolutely.
So we are very, very friendly with the supplemental plans. Not as easy working with the Medicare Advantage plans.
And I'm a big fan, just to carry on with Leslie, I really like Original Medicare. It allows you to go to any provider, in this case, to a religious non-medical healthcare institution like Arden Wood, and the supplement follows it in, as where the Medicare Advantage plans, and those are all the ones they advertise on TV, that you can get all these benefits for $0 premium or $19 premium or whatever that is, are much more restrictive. And I know just based on conversations with Rogers too, that they're not Christian Science friendly. They're very hard to get to pay on claims.
Absolutely, they are.
Perfect. Next up, I live in Florida is the long-term care insurance information provided this evening or a week ago, whatever, relevant outside of California? You kind of touched on this earlier, but maybe it's worth saying again.
Absolutely. It's good nationwide. It doesn't matter. I get calls from Florida, Maine, all over the United States. Every state it's good in, correct?
Excellent. Next up, my mother is currently in a non-Christian Science assisted living situation and under a practitioner's care. However, she is currently bedridden and requires care in all the ADLs or
Activities of daily living.
Right.
except cognitive ability. Could she be served by Arden Wood?
It is possible. Yes. I don't know what more to say right now. It also depends on what we have, when we have availability of rooms. We don't always have availability to admit, but feel free to call and inquire and we will see what we can do.
Thank you. Without any insurance, what is the cost of 1 day's stay in nursing care at Arden Wood?
Okay. I have my cheat sheet here. So this is where it depends on the level of care and the number of hours of care. And unfortunately, you don't get to pick which level you want to be at. We make that assessment based on the needs. So the skilled care for Christian Science nursing ranges from $585 to $900 per day. This level of care can be covered by Medicare, and it's Medicare Part A. So that's the one that you have, whether you know it or not. Pretty much everyone has it.
Right.
Part B is additional, which you may or may not choose to have. Christian Science care, which is a lighter care but not skilled care, is $275 to $600 per day. And sheltered care, which is like assisted living here, ranges from $175 to $275 per day.
Great, thank you. Some of these are repeats, but I think it's worth just mentioning this briefly again. Is a supplemental plan called long-term care insurance?
No.
No.
Good, yeah, it's for the viewing audience, that's why we're having these seminars. This is not easy to always get it. A question I sent a couple of weeks ago about my policy not needing a doctor, Mutual of Omaha, I hope is still true. Please advise. My financial advisor recommended Mutual of Omaha because of this. I purchased it around 2011 at the age of 63, I think.
Yeah, I believe Mutual of Omaha is one of the companies that still has a Christian Science rider on it. It depends on the state, so it's not nationwide, it's state specific. For example, in California, you can't get that Christian Science rider in California. So if you have it, hang on to it. Mutual of Omaha is a great company, by the way. So very solid financially, good company.
Great. What claims would not be covered by Medicare? Leslie and Rogers.
What we would say is not skilled care. So let me just say what skilled care is, and it varies. Skilled care could mean kind of a sudden need that's been presented. Again, we don't use names of diseases or diagnosis, but if someone suddenly is impaired, it could be that someone is having difficulty eating and not able to eat and having difficulties there. Something internal, if there's pain going on, could be the effects of a fall, an injury, could be a need for cleansing and bandaging. That is requiring skilled care. So the opposite of that would be where someone maybe needs help with toileting or a walker, uses a walker, needs reminders, needs help with activities of daily living, but care that could be given by a non-fully trained Christian Science nurse or even a family member with some guidance could care for someone. So, and Jim, you had some very specific things with the for long-term care in particular.
Right. You did a great job. I mean, you answered most of them there. So yeah.
Here's kind of a repeat. Is a physical exam by a medical professional required to qualify for a new long-term care policy or annuity-based plan for someone over 65?
Not necessarily. No, the ones I'm looking at right now don't. There's one that does, and I'm not a big fan of it because they would need a pyramid exam, which normally means they want blood and urine, right? That's just part of the exam, and that's more invasive. So I'm trying to find ones that aren't invasive. The annuity program I really like because they just simply, you answer a few health questions and they call you on the phone to go over them. So there's nothing there. There is no type of exam. And that's one where you can, you can actually triple what you put into your policy. So if you put in 100,000, you can turn it into 300,000, for example, by answering the health questions. And with Christian Scientists, I've yet to get a yes question answer to everything. You're incredibly healthy. So that's a policy that may work for a lot of people. I really like that too. It's non-invasive and it's much easier to get. And the benefits, quite honestly, are the same, and they pay out whether you use them at home or in a qualified facility.
Thank you.
Can I jump in and ask a question, a follow-up, Jim, on a couple questions ago when we were talking about the Mutual of Omaha policy, and you mentioned that Christian Science writers aren't saleable in California anymore. So does that mean that these policies are state specific? If someone living in Omaha,
Right.
buys a policy and either moves to California or likes Ardenwood, wants to come to California or to Ardenwood in California, would that policy then become not useful?
No, because it was issued when they purchased. It was on their policy. It's part of the contract. So that would be if they move into California, they could still use it. So the verbiage is just if you're living in California right now with that particular product, you can't purchase it. But doesn't mean if I purchased it in Montana or Nebraska or Iowa, I haven't, I come to Ardenwood and I could use it for that.
Oh, good. Okay. Thank you so much.
Great. My mother relied on direct payments to a different Christian Science facility for nursing care from my deceased father's plan with Aetna. We found them very beneficial. Do you have any experience with Aetna?
Not really. No, not. You're talking on the supplemental side, I'm guessing. Is that what they're referring to?
Direct payments.
I'm not quite sure.
Not really sure. I'm just reading.
I've never administered a Aetna policy through the times I've been at Ardenwood, so I don't have any personal information on them.
Right.
I know in the East Coast, I think the Mother Church has been working with Aetna, but not really on this side of the country. So I don't have much experience. Here's one for you, Jim. Would listeners today ever know what insurance company Jim will be talking to tomorrow that might be exciting for 70 to 90-year-olds?
Yeah, I can't. You know what? They asked me not to say the name yet because I wished I could. I would feel much more comfortable. I can pass along that information to John and Amy and Leslie and everybody and Rogers at Ardenwood. I want to make sure until I say something, if that makes sense. So
it does.
I would love to share it with you, but
we'll get that information out.
Yes.
We'll send an email to everyone who's registered, or we'll find ways to share that information for sure.
Perfect.
Great question.
I understand the Principal Foundation supports sheltered and other care at Ardenwood, etc. So why buy insurance?
I think it's a very personal decision. I think it's lovely to know that there are funds out there, but I think if an individual has the means to pay their own way, it would be a prudent thing to do. to ensure that that fund is going to be available longer for more people. That's just my personal view.
Exactly right. The fund was started to support Christian Scientists. It's not based on financial ability, as Roger said, but it's basically understood from a sense of integrity that it is for the purposes of helping people that might not be able to receive Christian Science care without it. Anyway.
And
Plus
we have
the
seen it work with insurance. Maybe someone has a Medicare supplemental, or they have some insurance, and maybe when that ends, then that is the time that they might be applying for it.
right. And the other thing is, they have a set fee. $350 is the maximum that I've seen them go on a daily basis. And as Leslie said, some of our fees at Arden Wood are much greater than that. So they'll cover some, but they may not cover all if there's a significant need.
Yeah, and I think it's important. Okay, here comes my insurance lingo, so get ready. So people ask me that all the time. Why should I insure, right? Why don't I just because basically you're self-funding now. So why should Jim tell me why I should get a policy? And a couple good reasons come to mind. First off, especially with this annuity that I'm talking about, you put in, I apologize, I'm going to keep using 100,000. It's just easy to deal with. You put in that 100,000 and it becomes 300,000. Well, what if you just had your 100,000? And like Roger said, what if you go through that 100,000 and you eat into another couple 100,000 of your own money? That's money that you can't give to your church or your charity like Arden would. So think about that. It really protects the rest of your assets and allows you those assets to go to your children and your charity and Arden would. So I think that's really important. People understand that there are options. That's why you get insurance, quite honestly. Did that make sense to everyone? Or
Sure.
Yeah. Okay.
Great. Well said, Jim. I am single with no family. What supplemental plan would be appropriate to cover my possible expenses?
Like Roger said, it really depends where you live and the cost. Plan F pays 100% of everything. Plan G would be appropriate also. It really depends. You can email me your information and we can certainly look at which plan may work best for you. It really depends the area you're in. And the key is almost all of them have coverage under Part A. So the real important part is to make sure that that's covered. So if you do go into Arden Wood or to another Rinky, that's covered in full, that you have no co-pays or after day 60, you don't want to pay that $371. So the supplement would take care of that for you.
Great. And once again, I'm seeing a lot of repetition, so I'm not going to repeat these, but there's a lot of excitement or interest about getting long-term care insurance after the age of 65. People are in excellent health. Can you still get long-term care? And so, that's great.
And John, just so I'm so used to dealing with non-Christian scientists that most people aren't healthy enough to get this. It's when people call me and say, Jim, I want a long-term care policy. I'm like, why? Did you go to the doctor? Yes. Normally in that situation, they don't have the health. The money pays for it. The health really buys the plan. And one thing all you scientists have, you have health. So that's a big deal.
Great. Here's an interesting question. It seems like many of these health scenarios that would benefit from a long-term health care insurance is just spending money to prolong a life that is greatly diminished. Sort of a not much of a life situation. What options are there for those out there for folks that may not want life prolonged in those situations? That is, can the plug be pulled?
Wow, that is an interesting question.
The
plug being pulled usually requires someone to be on life support, and that's not something we provide here. We are here about life. We are here about seeing healing and seeing the whole man. And regardless of age, seeing individuals continue to grow spiritually and to regenerate, to see healings in relationships and family, and that we do see that. We see that no matter how old people are. That's all part of the healing.
Absolutely.
So.
Absolutely.
I think, and another really important thing, I think, is the thought surrounding the patient. That is just something that is so important. You know, we are not expecting someone to come here and die. We are expecting people to come here, focus on their healing, work with the practitioner, be supported by the help of the Christian Science nurses, and be healed and go home. That is our expectation.
Is it time for a joke? I remember this is one of my first, this is World War II. This young GI looks up in the eyes of a nurse and says, and he's in England, and he says, did you bring me here to die? She goes, oh, no, sir. We brought you here yesterday. Sorry.
Yep.
But bum. Does Medicare pay for hospital costs prior to moving to a Christian Science nursing via the Ahcd directive?
If you're in the hospital and it's a Medicare covered claim, yes, they would cover for that period of time. And then coming to Arden Wood, we would pick up from whatever day count it is. You know, we talk about this 60 days of Medicare that you have. So if you're in the hospital for 2 days before you can get released to come to Arden Wood, that would be day 1 and day 2. When you came to Arden Wood, we would start at day 3, working our way through day 60 if that were necessary on the claim. So as I understand the question, I would say yes.
And the most frequent scenario of that would be if someone were to fall and break a bone or go for x-rays and maybe have a bone set and then come to Arden Wood for their rehab period. So Arden Wood, as a religious non-medical healthcare institution, is both hospitalization and skilled nursing facility. We actually are both together. In a typical medical setting, you're in the hospital a few days, they release you and send you to a SNF, skilled nursing facility, for your rehab. We do both here. So the days count a little differently. It's all under the Part A hospitalization part. So as Roger said, you might use a few days first in the hospital, then you will continue in that benefit period here.
Here's a question from Southern California. Would Sunland Foundation, which is a beautiful facility in Encinitas, one of our sister facilities, be qualified for all of these benefits the same as Arden Wood?
I don't see why not.
They're a Medicare Part A facility as well. Yes. Beautiful, beautiful place down there.
Beautiful facility.
Have you ever had anyone with a UNUM contract with a Christian Science writer?
Yes.
Oh, okay.
I think isn't that Jim? UNUM is.
I thought that you were talking about specifically the Leslie or Rogers. Yeah, Unum's another, was a long-term care insurance rider too, and I don't see them out there very often anymore. Really don't. So I don't know if they had a rider on there or not.
Might have been an old policy, but I have seen them.
Yeah, they're definitely, I think, over 20 years ago, but I don't think they're writing them anymore. But do you have to have Medicare Part A and Part B before you can get a supplement?
Yes.
Here's a good one. How is long-term care, quote unquote, as opposed to short-term care, quote unquote, definitions?
So normally the verbiage is if you cannot do 2 of 6 activities of daily living that's expected to last for more than 90 days. It's kind of the tax qualified plans. The same if you have a cognitive impairment, it's expected to be more than 90 days.
Great. If one were to call or email a question to Jim, Does he charge a fee for helping to answer it?
No.
Jim, you are amazing. The hours you have put in on our behalf, and when we hear how many conversations you've had, and
Yeah.
I mean, I had a bunch of emails, and I know you've gotten exponentially more in the last
Yes.
week. But
That's
just
why I apologize.
how
And I'm
grateful
telling
we
you,
are.
everyone, I'm trying to get back to you as soon as I can. I will. I promise. It just takes a while. Katie in my office is awesome too. She's also certified long-term care and understands. So she's going to start helping me so we can get back more quickly, respond more quickly to people. So,
Jim, could you explain to everyone how you do make your income?
sure. John usually sends me a big check. No, I'm just kidding. No, quite. I didn't mean to say. I shouldn't have said
Just
that.
so we understand how an insurance broker
Yes.
works.
That's super important. So I'm a broker and a consultant. So if I were going to charge a fee for my time, I would make that known up front and say, I'm going to charge you X amount. If you're an insurance company, I consult with them, I charge them a consulting fee. For most consumers, I just help them, simply assist them. And when they place business through me, the insurance companies compensate me. So it doesn't cost them anything. And I've just made decisions years ago that it's not worth trying to, I don't want to charge somebody a fee and then say, gee, I'm also going to be compensated by the insurance company. I don't think that's right. So I try and help as many people as I can. Like I was talking to John yesterday, my dad was a big believer in, listen, if you want to get something, you need to give something. So I believe that I'm trying to help as many as I can. I can't always help everybody, but I try. And when we go to, for example, AARP United Healthcare, if I place business with them, they pay me. So that's how I've stayed in business for going on 33 years.
And that's the typical insurance model. That's great. We're grateful, Jim. Do asset-based long-term care policies cover care at Arden Wood or at the Christian Science Benevolent Association in Chestnut Hill, Massachusetts?
It would depend, like, right, Rogers, if they had an indemnity plan like the one through Nationwide, if they're paid cash and then they go in, as long as they're on claim, they can do whatever they want with the monies.
Yeah, well, isn't it again whatever the trigger mechanism is?
Well, once it's triggered, once the benefits are started, so say that happens at home, right, for home care, and then maybe they do go into an Arden Wood, as long as they're still receiving the benefit, it's cash. They can do whatever they want with it, with the monies.
What would you recommend for a supplemental insurance if you are covered by Medi-Cal? I'm not sure.
Boy, that's so Medi-Cal, it's Medicaid nationwide, so everybody understands it. In California, it's Medi-Cal. And there's different options for, they call them a dual eligible if you have both Medicare and Medi-Cal. And a lot of times they're more of the Medicare Advantage type plans that are more beneficial. It depends on your level of need also. If it's a hard question to answer, but usually it's the Medicare Advantage plans I see that are more advantageous to somebody on Medi-Cal.
And Arden Wood is not a Medi-Cal provider.
Correct.
Right.
Or Medicare, but not Medi-Cal.
Since you're talking about letters, Medi-Cal, Medicaid, one thing that several people have requested is just to be reminded of what Ahcd stands for and what RINKY stands for. We're using those acronyms, and some reminders would be helpful.
Okay. Advanced Healthcare Directive, and it could be a living will, a healthcare proxy. Different states have different names for it. In California, it's Advanced Healthcare Directive, a document that designates an agent to make decisions for you should you ever be unable to make decisions for yourself. So it's a protection to you. RINKY is the name that Medicare has given to our little group of facilities. We are at this moment the only ones in that group. It stands for Religious Non-Medical Healthcare Institutions. So it is what Christian Science, we used to be called Christian Science Sanatoriums. Medicare changed that in about 2000. We became RINKYs.
Thank
I think there
you.
was legislation with Senator Ted Kennedy and who is from Utah, that senator. They worked
Orrin
together.
Hatch, I believe.
Orrin Hatch.
Yeah.
Mhm.
Both those senators worked diligently to get this passed to us to qualify.
Maintain our accommodation, which we've had since the very beginning of,
1965.
yep.
The Medicare legislation, correct.
Mhm.
What are the reasons given by Medicare for refusing to pay for hospital stays during Medicare Part A?
That's a Jim question.
Yeah.
I was going to say that's a Leslie and Rogers
No.
question. That so if you're not admitted to the hospital, that would not be covered under Part A. I can talk about in a non-Christian facility, for example. I've seen that where you're under observation, you're not admitted, and that's an issue. That's a major issue outside of the Christian Science world. But as far as going into, you're admitted into Arden Wood, that right? You admit them, that would be covered under Part A.
And we
I'll
are
do
only
Rogers.
Part A. Mhm.
Right. And the only time that it wouldn't is if there was some technicality that you could not use your Medicare benefits at a rinky. Doesn't mean you can't come to Ardenwood. It just means Medicare won't cover. And that technicality would typically be if you've had an election and you revoked it.
Twice.
Yeah, twice you have a waiting period of a year. 3 times you have a waiting period of 3 years.
5
Is that right?
years.
5 years.
Mhm.
So, there is an outside chance once you make that election, you do sort of have to be a little
Very
conscious
careful.
of how you're, very careful and be conscious of how you're using your Medicare benefits. Because essentially once you've made an election, anytime you use Medicare benefits outside of a rinky, you have revoked your election.
Yeah, the election form is saying, I choose to use my Medicare benefits in a religious non-medical healthcare institution. It's a notarized document that you are stating that. So if you then go, let's say you have a bone set, that will automatically be a revocation if you've used your Medicare for that. So then when you come back to the facility or come to the facility, and it's only after you've already had the election form in place, you can do a new election form. So you get grace for the first time, but the second time is where that penalty comes in, that you can still use your Medicare, but not in a rinky for 1 year from that date. And then you have that benefit available again. They don't want you going back and forth. So choose wisely.
One thing that you've always said, Leslie, I think is helpful to understand what we mean by Medicare Part A as for a Christian Science facility is that think of it as if you had a need to go to the hospital.
Right.
Can you just use that?
Yeah,
That's a great explanation.
So it's kind of what is a qualifier for Medicare is if you're presented with a challenge where someone else might be going to the hospital emergency room, where there is a need for skilled care, an immediate need, that is a Medicare coverable event. So it doesn't require diagnosis. We just think, gosh, common sense. If it would be coverable in the hospital, it's going to be coverable here. So.
Great. Next up, are you familiar with this I think came up last time too. Are you familiar with GEHA insurance, which covers Christian Science nursing homes?
Well, again, I think that, came up last time. I think that's government employee health contract or something like that. I've talked to a couple people that have that. I haven't ever administered anyone here, so I don't have any other knowledge of it.
Can you just both mention, Rogers and Leslie, we do take insurance from those that have served in the armed services?
TRICARE for Life?
TRICARE for Life, right.
We do accept that at Ardenwood, yes.
Yes.
Thank you.
Yeah, and that would be your supplemental. That would serve as a supplemental.
Could Could you give an example of the cost of the long-term care policy starting at 65 and how much of the long-term care it would cover when triggered?
Again, it's everybody. It's hard to, I can't give you a specific amount because I just don't know enough about you. But once the policy's in force, even if you had rate increases, as long as it's still in force when you trigger the benefits, it would pay. Did that answer the question, John? Did that make sense?
I think so. I think so, yes.
It's just so hard to give specific because everybody's
Right.
like, I always say, well, how much does a home cost in California, right? It's nobody knows. You know, if you're in Redding or Fresno or San Francisco or Beverly Hills, it's just so hard. It's just everyone, there's no cookie cutter plans for long-term care. Everybody's different. So that's why we try and judge, you know, help everybody individually.
Exactly. Do you have to have a whole life insurance policy to convert to LT, long-term care, or can you also convert a term one to long-term care?
Normally, the whole life is a type of insurance policy, right? It's that you can convert that. You can also use other assets, right, to use for it. It doesn't necessarily have to. But a lot of these long-term care policies are designed to accept exchanges from life insurance policies or annuities, life insurance into annuities, if that makes sense. I mean, we kind of go down the rabbit hole on that. So, some of Roger's helped me on that. Does that make sense?
It does. I don't have any knowledge of the insurance industry specifics, so can't help anybody on that.
Yeah.
Okay, we're coming, I feel like some of these are repetitive. Again, our medical physicals required to get an asset-based long-term care policy.
Some nationwide right now is being very good to Christian Scientists up to, I think, I have to remember, I think through 69, we're good, I believe. And I'm looking at other options for the next question is, what about people over 69? I'm looking for options to try and help on that too.
Now, one clarification on that, Jim, you mentioned several times up to a certain age. The policy itself, as long as it stays in force, would continue to pay up to any age. Isn't that right?
Yes.
Okay.
It's just they call it issue age. So you can only get it to a certain age. And a lot of the insurance companies, quite honestly, they don't know how to handle Christian Scientists. They've never seen anything as healthy as you. They're used to a non-healthy population where they can go, listen, if I have a village of 10,000, I know X amount are taking these medications and are this sick, and they can actuarially underwrite the policies. With Christian Scientists, they're going, well, there's no medical records, right? You're healthy, and it's hard for them to understand that. It just is. So that's my challenge. But once you're right, Roger, once the policy is in force and you pay the premiums, it's good as long as you're alive and you want to use it, or you can use it. Yeah, it's valid.
Good.
I've got a couple Medicare questions. We're coming towards the end there with our questions. Seems to be Medicare. There are a lot of supplemental parts of Medicare. Which one are you talking about? I guess that it depends.
So today we've mainly talked about Part A, right, for the for Arden Wood, for a Rinky. Part B is, I always look at Part A as the accommodation side. You're going to spend the night somewhere. That's normally, you know, in a hospital and a skilled nursing facility, which would be Arden Wood. That's Part A. Part B is everything. Yes, Part B is everything else. It's the doctor side, the urgent care, outpatient surgery type settings.
Leslie, this goes into Rogers. If Medicare helps pay for an eye exam for glasses, does that cause non-payment for care at Arden Wood?
That would be a revocation.
That would be revocation.
Yeah.
And, you know, actually, sorry, Leslie, go ahead.
No, I was just going to say that's one, if it's a smaller expense like that, it's better to pay out of pocket. So It's not a revocation if you have never done an election form, if you've never been in a Christian Science facility. They don't look back at your history. It's only once you have established that election
Action.
form and used it within a facility, then it's on your record that that's your choice.
Yeah, and then anything you do outside of a Christian Science facility, it doesn't have to be the same facility. It could be, Arden Wood and Chestnut Hill and Sunland, whatever. But anything outside of a Christian Science facility will revocate, including, I was on a call earlier this week with Medicare. Anyone who uses Medicare to pay for an inoculation or a vaccine for COVID, and if you have an election in place, that will create a revocation.
That will.
That was the ruling from Medicare this week.
Oh, wow. Because
Very
we had
interesting.
heard different information from a committee on publication recently. Because because it is not mandated right now.
Correct.
If
That's
it were
what they're
mandated,
based on.
then it would be accepted. Yeah.
Yes.
Rogers, would you please repeat that since that seems to be so important?
If you have an election in place, so this is only for people who have an election in place. Generally, that's only for anybody who's been to a Christian Science facility. If you use your Medicare benefit to pay for the COVID-19 vaccine, it will cause a revocation.
Interesting. That's the first I've heard of that because we've had several meetings. That might be something we want to put somewhere on our website or something. But it could change as well.
It could change, yeah. That's as of Tuesday from a Medicare representative.
Great.
Okay.
Thank you for that, Rogers. If someone buys asset-based long-term care insurance, I understood there was some possibility of money being returned if it wasn't used. Is that correct, Jim?
So important, yes. There's a death benefit that goes along with most all asset-based plans, which if you don't use the benefit at all, normally whatever you put in, you're going to get a death benefit, and that entire death benefit would be paid out to your beneficiary. Like, for example, in one of the annuities, if you used a portion of what you put in, maybe $50,000, then that would be subtracted and the remainder would go to your beneficiary, for example. That's normally how most all the policies function that's asset-based.
Great. Looks like we have our last question for this evening, for this discussion.
So, John, is this like Final Jeopardy? Do we have to like give a
bonus
That's a
round?
good question.
Can you give us a category ahead of time? See who's going to.
Medicare for 100. Yeah.
Okay.
Let's see. Can you talk about supplemental Medicare for a 79-year-old?
Sure. Right. So if you have parts A and B, you're eligible for a supplement. You're probably outside your guaranteed issue, meaning they have to give you the policy. But most every Christian Scientist I've talked to, they ask you a few health questions. And if those are no, you can get the supplement at any time. It's month to month. So if you want it for May or June or July or whenever, you just simply have to be able to answer the health questions and respond no to them, and you can get the supplement.
Great.
Actually,
Oh, I forgot to answer in the form of a question. I knew that, John. Okay. What is, oh, sorry.
I have to say that the statement about the vaccine has created a couple more questions that I have right in front of me. So let me
go
ask
ahead.
them.
Yes,
One
please.
is, will a COVID-19 vaccination be a revocation if it's done because it's insisted upon by a next of kin?
My understanding was the reason it created a revocation was because it's not mandated by law. That's where we can have the loophole of not having a revocation. That it's, yeah, I don't think family has any issue here.
Okay, and related to it, if someone had a vaccine that was required by work, has Medicare, but there was no charge for the vaccine, does that mean the individual had an election? Or
Well, one, if you haven't been to a Christian Science facility, you probably have never made an election.
Right.
And so that's the only time that this even comes up into an issue.
Well, and it's only if they actually bill Medicare for it. So if there was no charge, then they would not have billed Medicare.
As long as they didn't
Provide
produce
the
their
Medicare
Medicare
information.
card.
Mhm.
Because, yeah, it could be the person thinks, oh, there was no bill because they didn't receive one because it went to Medicare.
Yeah.
If you didn't give them any of your Medicare specific information, chances are, yes, it didn't go against your Medicare record.
Great. Okay, two others, quick ones. Can you get a supplement at age 80 or older?
Yes.
Great. And the last one, this is about naming an agency on an advanced healthcare directive. I'm a widower, and since some of my siblings are Christian Scientists and some are not, I would like to avoid family friction about my care, so I'm not naming any sibling for my agent. Could you point me in the direction to selecting a non-Christian Science agent?
Wow. Often I'd say when family members, if you choose not to list a family member, but your choice is to have Christian Science care, often people have gone to a close friend from church or something that would respect their wishes. And that eliminates the friction from the family because they know that, you know, the choice of care is what this person would have wanted. I know it should not be a Christian Science practitioner or Christian Science nurse that is involved in the care of that individual. That's just an ethical line you don't cross. So it could be a friend. It could be a neighbor, someone you were close to, long-time family friend if you want, as long as they understand what your choice of care is. It would need to be someone that would understand that and would honor it.
Exactly.
And there's one more question sneaking in. If you are put in a hospital without your choice, so perhaps even in John's situation where he woke up and found himself in the emergency room, does that revocate your coverage at a Christian Science facility?
No.
That's one of the accepted cases. Yeah,
Great.
exceptions.
Well, I'd like to just summarize a few of the points that stood out that I think will be helpful to remember. One is that the Advanced Healthcare Directive, or the AHCD, is very important to put in place and to share where it is with a family member or a close friend so that if there's a need, someone else could find it on your behalf. Another is that there are funding options for those of us who might not have long-term care insurance or be disqualified. There are other options to support your need and to help cover the financial burden. A third point is that it's important or helpful to have Medicare and a supplemental plan before you launch into long-term care insurance. Another point that I want to assure everyone is that we will post the names of the carriers that Jim lets us know are willing to work with Christian Scientists on our website so that you can find it there, and we'll let you know when that information comes out through an email. Another point is that I think we've all realized that the cost of long-term care insurance is highly individualized based on your age, your well-being, and when you're applying for this kind of care. So there are no simple answers, but all the more reason to call for help. And that brings me to the last point. You will not be charged for calling Jim, Leslie, or Rogers. Just give a call and ask the questions you have. That's it.
Perfect, Amy. Thank you for wrapping that up. That's very helpful. And thank you, Leslie and Jim, for guiding, and Rogers for guiding us through the ins and outs of long-term care insurance and Medicare options for Christian Scientists. Jim is the best qualified to answer questions on this subject, and Ardenwood and the Christian Science Provider Network can serve as an ongoing resource as well. Please don't hesitate to call with questions at any time, as we stand ready to help. And again, thank you one and all again for joining us today. Please save the date of Sunday, May 2nd at 2 p.m. Pacific for our online Ardenwood annual meeting featuring inspirational speaker Madeline Maupin. Please check our website soon to register. And also, we will be having more of these Medicare seminars and long-term care insurance seminars. We're trying to figure out just how we're going to do that going forward. So stay tuned. We hope you found these things, or these programs rather, to be helpful. We look forward to serving in any way possible in this regard. So thank you all, and goodbye for now.
Bye, everybody.
Bye-bye.
Bye.
Bye.